Welcome everyone. Today I'm going to discuss about WHO define the health system and their function, segmentation and fragmentations, major system challenge, model of care and organizational model and definitions. Bubble towers, health system, all the institution, people and action whose primary purpose is to improve health, improve people health and well-being, responding to the people expectation, providing protection against the cost of ill health. Health system, service delivery, governance, financing, and governance of the resources. Health system, health service, healthcare provider, delivery of the care is only one of the health system functions. Health service are the set of institutions and programs that provide direct care to health and disease need of individuals and public health services for the protections of the collective health. Major system challenge fragmentations. Major system challenge segmentation, the coexistence of the substance with different modalities of the financing affiliations, healthcare delivery, each of them specializes in different start of the population according to their type of employment, income level, ability to pay, and social status. Major system of challenge fragmentations of the health service related to the coexistence of the several unit or facility that are not integrated into the signal networks or service at different levels of care that are not coordinated among themselves of care defined healthcare delivery that does not cover the entire range of promotion, prevention, care, rehabilitation, and palliative care service and or service that not continue over time. Addressing fragmentations of care, new model of care, fragmentation of service, new ways of organizations and managing healthcare delivery service. Universal access of health and universal coverage, universal access, absence of the geographical, economical, social, cultural, organization, and gender barriers that prevents all people from making equitable use of comprehensive health service. Universal cover the sufficient organizational mechanism and finance to cover the entire populations. For simulators and interpretation strategic lines, equitable access to the health service, increasing financial with equity and efficiency, strengthening intersectoral coordinator to HDS, Shrives and governance. Expanding equitable access to the comprehensive quality people and community-centered health service. New models of care, new models of organization, new ways and capacities for managing healthcare delivery service, comprehensive and progressively expand health service, increase investments in the first level of care, improve and increase the response capacity of the first level of the care in IH, SD, and S, identify the unmet and differentiated the health needs of the populations, as well as the specific needs of the group in the situation of the vulnerability. Improve human resource capacity in the first level of care, essential medicine and technologies, empowerments of the people, communities. Expanding equitable access to comprehensive equalities, people and community-centric health service, new model of care, new model of organization, new ways and capacities for managing healthcare delivery service. Comprehensive and progressively expand health service, increase investment in the first level of care, improve and increase the response capacity of the first level of the care in IHSDNS, identify the unmet and differentiated health needs of the population as well as the specific need of the group in situations of the vulnerability. Improve human resource capacity in the first level of care, essential medicine and technologies, empowerments of the people communities. Universal access of comprehensive quality, progressive expand health service. The model of care should be coherent with the strategic visions for health and well-being. The redefining of the model of the care constitutions a core decision moments in movement towards universal access to the health and the universal health coverage. The new model of the care will requires new organizational arrangement in order to be effective, efficient, and quality oriented. Universal access to comprehensive quality and progressive expand health service. The model of care must be strategically defined in order to option health outcome. The model for organization management of the healthcare service must be addressed from a system perspective and let not forget the determinant of the health. Basically, it really does not make much sense to provide excellent care, clinical and hospitals. Model of care, a logical framework that defines what services will be provided under the health needs, demand and expectations of the population, organizational model, the structural organization and resource required for delivery, services response to those needs, demand and expectations. Model of care versus organizational model, governance and stewardship, financing, resource general, model of care, organization and management and service benefit. Training models of care, values, focus, governance, financing, provisions of services, development of the resource system approach. Biomedical model of care, centric of actual episode care, supply delivery organization by level that fragment cares, hospital based and development on costly technologies and special cares, provision of cumulative service through fragmented process of care, lack of continuity, poor quality and safety. Lack of continuity, poor quality and safety, insufficient several systems, and government sexual exclusion and dissatisfaction. The biomedical models care and the radar phenomena. The patient show up, the patient is treated, the patient is discharged, the patient vanish. People-centric models of care, distinct element, people-centric, integrated, comprehensive, continuous life course approach. Organizational model, structural organizational resource required for delivery to service in response to those needs, demand, and expectations. Fragmentation of the healthcare delivery and care. Health service, what push the needs to the change in demand, change in other, change in social. Integrated health service delivery network define a network of organizations that provide or manage to provide equitable, comprehensive, integrated, and continuous health service to defines populations and is willing to be held accountable for its clinical and economical outcomes and the health status of the population serves. Integrated health service delivery networks. People and community-centric planning and delivery based of needs, responsible for a assigned population in a specific territory, network of facility, multidisciplinary team as the first level of care, delivery ambulatory specific service at the most appropriate location, mechanisms of coordinated care through the continuum. More define an importance of the semantic. Babel towers, primary healthcare versus primary cares. These are the very interesting aspects of healthcare systems, and this is the way we can develop and utilize our knowledge and expectation in a proper way. Thank you. If you have any question, you directly can communicate with me. Thank you. Bye bye and take care.